Hello, everyone. Welcome to the Dr. Sophia podcast. I'm an OBGYN practicing for over 15 years in my native New York City. And I love to help women learn about their bodies, empower them, and embrace themselves. On this podcast, we will talk openly and with heart about all things affecting women, from pregnancy, menopause, periods, sexual health, fertility, and so much more. Disclaimer: this is general medical information based on my professional opinion and experience. For specific medical advice, please refer to your physician. Hello, everyone, and welcome to the Dr. Sophia OBGYN podcast. Today, I am so excited to share our episode on preeclampsia. It just so happens that May is Preeclampsia Awareness Month, and why not take the opportunity to talk about a topic that really just isn't covered enough, that we all just don't know enough about, and that can affect so many women. And so we thought, why not talk about it? And as always, I am so happy to be joined by my good friend and co-host, Tusef Mirza.
Hi, everyone. So thank you for joining us again. So this time we're going to be talking about preeclampsia. By the way, am I saying that correctly? Is it preeclampsia or preeclampsia?
It is preeclampsia.
Preeclampsia.
Preeclampsia. And the reason why actually it's preeclampsia is because eclampsia is also its own thing.
Oh.
And it's the pre part is the thing that can happen before eclampsia. And so, to be fair, the goal is to identify women who are at risk for preeclampsia so they don't even progress to eclampsia. So it's preeclampsia.
Okay. I had no idea that those were two separate things. So let's start.
Let's dive in.
So number one, can you explain what is actually preeclampsia?
So preeclampsia is a high blood pressure or hypertensive disorder that happens only in pregnancy. So preeclampsia, when we think about it, it happens to women typically after the gestational age or after they are 20 weeks. We don't even think about a diagnosis of preeclampsia until you're after 20 weeks of pregnancy. But the majority of women who experience preeclampsia are actually in their third trimester and nearer to the time that they would deliver. So let's say 36 weeks to 40 weeks. But it can be diagnosed as early as 20 weeks.
So when we say preeclampsia, so we know like when it occurs and it's in pregnancy, it's really for pregnant women. What actually happens, like in terms of symptoms?
So the hallmark of preeclampsia is really typically it's the high blood pressure that starts to happen. So it could be someone who's never experienced high blood pressure before, and now let's say, as an example, they're 32 weeks pregnant and they come in for their office visit, and all of a sudden they have a blood pressure that is 140/90. So normal blood pressure is anything, 120/80 or less. And in pregnancy, women typically have low blood pressure. It's not uncommon to see a woman come in with 90s/70s, and that is a completely normal blood pressure in pregnancy. So definitely we are concerned once the blood pressure hits 140/90, and that is a reason for us to now start to conceptualize, hey, could this pregnancy be affected by preeclampsia? And the blood pressure is only one aspect. It's also typically associated with something called protein in your urine. So for a lot of women, they're like, oh, how come they ask me to pee every single time I go to the doctor? Don't they already know I'm pregnant? Of course we do, but we're checking other things. And one of those things that we're checking is whether or not there's protein in the urine.
I'll be honest, the first time that I really understood preeclampsia, And the gravity of it is when I actually watched this series. I'm sure a lot of people know about it, Downton Abbey, which was about 10 years ago. It was, I think it was on Netflix. And it's basically a historical series in the 1920s. And you had a woman who was the youngest of three daughters that were, super wealthy in the area where they lived, and she had symptoms. And then after the symptoms she had just before she gave birth, then she gave birth, and she seemed to be fine. And then the series depicted the woman of literally going through seizures, almost like convulsing and dying. And the doctor that was there said that this is preeclampsia. And so obviously there's some grave complications, to my understanding, that happens when you have preeclampsia. But one of the things that I think we don't realize is that was a piece, for me anyways, that was my understanding, that was a piece that was depicted in the 1920s. And since we don't talk about preeclampsia really now, I thought, well, this is probably something that we've dealt with, and that, it's not too big of a deal now. So this is why we don't really talk about it. But actually, that is not necessarily the case. That we
absolutely not.
That we still have
affects 1 in 25 pregnancies. It affects a lot of women. 16% of pregnancies here in the United States are affected by preeclampsia. And I just want to review that we talked about the signs of preeclampsia. So when I talk about blood pressure and elevated blood pressure, something that's 140/90 as being a potential sign of preeclampsia, and the protein in the urine as being a sign of preeclampsia. But a symptom of preeclampsia is typically severe headache, changes in your vision, upper abdominal pain, especially in the right side, severe abdominal pain, like around your uterus, just the whole thing feels like it's on fire. It's like a severe pain that doesn't go away. It feels like it's tight, or a stabbing pain in your uterus while you're pregnant. And these are all the symptoms that can happen in terms of preeclampsia. Now, why is preeclampsia so dangerous, or why is it so important that we are able to identify it and then manage it and treat it, is because of exactly what you're talking about. That episode that happened in Downton Abbey, the concept that a woman could have some symptoms, then she gives birth, and then she could still have symptoms and develop eclampsia. So when she had the seizures and the convulsions that you're talking about, she now progressed to eclampsia, and that can lead to things like stroke. And exactly what happened, unfortunately, it can actually lead to death. And so it's definitely not something that is only historical. It is happening right now all the time. And there's a documentary on a young woman who passed away, and it was from complications of preeclampsia for a woman her name is Amber Rose. And I remembered hearing her story, and immediately I was like, oh my God, she had preeclampsia. And yet she was never really diagnosed until it was too late.
What was that movie called?
Aftershock.
Okay.
And so it's something that's happening, unfortunately, all the time. And the bigger problem is that, Black women, for example, are 60% more likely to be diagnosed with preeclampsia. Okay. And we all know the statistics as far as, Black maternal health, that Black women are dying at a higher rate than their white counterparts. And this is one of those illnesses and complications of pregnancy that is affecting Black women more, or at least certainly not treated enough. And if we don't treat and understand preeclampsia, like, patients need to know what it is. Patients need, women, we need to know that this is something that can happen. What are the signs and the symptoms, so that we can have a better grasp on when we need to get help. And oftentimes it's the misdiagnosis or a diagnosis that happens too late is what leads to the mortality that's so high when we talk about preeclampsia.
I want to just go back a little bit to understand what is preeclampsia in terms of, yes, you said that it was high blood pressure and other types of symptoms, but how is that actually causing the level of gravity of complication at the level of the uterus?
So the reason why preeclampsia is such a major complicated illness in pregnancy is because it can affect so many organs. It leads to multi-organ damage, basically. And when we're talking about it specifically to the uterus, is that it increases your risk of having something called an abruption. Now, an abruption is a big word that just means a separation of the placenta early from the uterus. So now imagine you have not given birth, your baby is still inside, and your placenta separates.
So you have the uterus, and inside you have the placenta, and inside the placenta you have the baby, just to be clear.
So just to be clear,
yes.
Actually, so you have the uterus, you have the placenta, you have the sac that's holding the baby and all the fluid that's around the baby and the baby. So the placenta is actually the part that's attached to the uterus. And then through the placenta is the cord, the umbilical cord that connects to the baby. And so the placenta is that interface that helps to feed the baby and is breathing for the baby and helping your baby to grow. Your placenta is an organ and it is working for your baby. And so now a person who has preeclampsia has an increased risk of having that placenta separate, shear off the walls of your uterus. And that placenta is a very bloody, blood-rich organ. It's the blood of the placenta that travels through the umbilical cord to give the baby all the nutrients and oxygen that it needs in order to grow and thrive. And if we separate the placenta, A, you're going to have major bleeding. And B, we have now stopped all of the nutrients, the oxygenation, most importantly, to the baby, immediately.
So it's not just a complication that affects the mothers, but can also affect the baby.
The baby, yes. Yes, a major problem actually, or consequence of preeclampsia is not just that it affects 1 in 25 pregnancies, or that, it affects up to 70,000 pregnancies worldwide and is responsible for the mortality of up to 70,000, maternal deaths. It affects up to 500,000 fetal deaths as well.
Worldwide.
We're talking about worldwide here. That because of preeclampsia, women can lose their babies as well.
So when we say now the placenta has a possibility of detaching itself, is it because of the high blood pressure that is causing that?
The thing about preeclampsia, unfortunately, is that we know a lot, but there's still a lot we don't know. And yes, it's typically from the severe ranges of the blood pressure that then can cause this early separation of the placenta, that can cause the progression to eclampsia, that can cause the progression to having things like stroke, that can cause the progression of having other heart issues, something else called pulmonary edema, which is where the lungs get filled with fluid and swelling. So preeclampsia can affect, like I said, it's a multi-organ damage if it's severe and if it's allowed to progress. And at the end of the day, the cure for preeclampsia is delivery. We don't fully understand what causes preeclampsia, but we do know that there is some placental interaction that does lead to the preeclampsia. And so delivery of the baby, delivery of the placenta then starts to take away all those mediators, all those things that are causing the preeclampsia in the first place.
So it's almost like we have to look at this type of complication from different phases. First it's before delivery, then during delivery, and like the episode I watched on Downton Abbey after delivery.
So the thing with preeclampsia is that preeclampsia can affect you during the pregnancy, for sure. Like I said, it can be diagnosed as early as 20 weeks in the pregnancy. Preeclampsia is mostly diagnosed around the time of labor and delivery, or those few weeks before you go into labor and delivery. And preeclampsia can still be diagnosed even after you've had the baby, despite the fact that we usually think of the cure for preeclampsia is delivery, right?
Oh, I
no
understand what
longer
you mean
being
now.
pregnant.
Okay. You're basically saying if you're delivered, then most likely you will not be affected by preeclampsia.
Well, more than that, if you have preeclampsia, once you are delivered, then we start to take away the mediators, the things that cause the preeclampsia in the first place. And then it starts to resolve itself.
So why then do...
But some women, yes, I see where you're going with this.
You know me, I like to investigate.
I see where you're going with this. Then why is it that women can develop preeclampsia after they've had the baby? Is because we don't understand preeclampsia all that well. And yes, preeclampsia can definitely present itself for the very first time after you've actually delivered the baby. And oddly enough, that first couple of days after you've had the baby is still your high risk time for developing preeclampsia, and up to 6 weeks, even
up to 6 weeks.
Up to 6 weeks.
Wow.
After you've delivered a baby, you can still develop preeclampsia. Now, 6 weeks later, less likely.
Yeah.
Okay. But it still has to be top of mind when a woman comes back for her, she comes back 4 weeks later, or not even, she's 2 weeks later and she's complaining of a headache after she's had a baby. And then you say, well, did you check your blood pressure? And her blood pressure is 140/90. I need to be thinking this woman may have preeclampsia, and I need to be aggressive in how I'm making sure that she does not have the diagnosis, or that she has a diagnosis so that I can manage it.
So considering that preeclampsia does have certain unknowns in terms of, are we going to get preeclampsia after delivery or not, for example, then this knowledge is so important, like for people to know that, number one, this can happen even if you've had a good pregnancy.
Yes.
And that number two is to understand that we need to become self-aware of what our bodies are communicating and
to
then
us.
Express that, and not just to say, because, we just, we have a headache. This is probably motherhood.
So the hardest part about preeclampsia is probably even after a woman has delivered, because, like I said, let's review. I'd like to go back over the symptoms of preeclampsia: headache, fatigue, changes in your vision, swelling even, which is fallen off of the symptoms chart per se. It used to be, first of all, preeclampsia has had a couple of different name changes, but some older people may remember it as being called toxemia. So if you, speak to your grandmother and she'll say, oh yeah, I had a touch of toxemia.
A touch?
I'm telling you, because we're so designed not to really discuss things that happened, especially if they were traumatic or what have you, that this is exactly how we may remember someone way back in the day. The doctor may say, hey, did anyone else in your family, did your mother have preeclampsia? Did your sister have preeclampsia? Because it's also something that can run in families, so it's important to know, did anyone else that was a first degree relative have preeclampsia, for example, or high blood pressure in pregnancy and things like that, as things we should know about. But moreover, it's that after a woman has delivered who develops preeclampsia. Why is that such a dangerous time? It's a dangerous time because it's so easy for us to dismiss some of the symptoms, like a headache. It's easy for us to say, oh, you must be tired. You haven't slept. The poor baby's keeping you up, and that's why you have a headache. Or for ourselves to make those kinds of rationalizations. And then by the time we realize that headache may be the worst headache of my life, it may be too late. And so that's why it's so important that we always are understanding what our bodies are trying to communicate, like you said. Because if we are at least expressing how we're feeling, what's going on, then there's an opportunity there for us to address it. And it's also important that if you feel like you're not being seen or heard, right, that you are going to the doctor, you are saying that you're having a headache or that you're feeling extra fatigued or you're more swollen than you ever were. Now, granted, you can have swelling after delivery because all of this extra fluid that our body has had during the pregnancy has nowhere else to go but down. Oftentimes women have, swelling in their legs and their feet that they never had before. And it's only after pregnancy that they develop that. But if it's not an association necessarily with any of these other symptoms that I'm talking about, then it's likely not preeclampsia, right? It's just the normal, process that our bodies are going through after a baby. But I think it's fair to ask the question to your physicians, to your providers, to your whoever's taking care of you, your midwife. I don't know, I'm having all this new swelling. And then maybe even for yourself to say, I'm having this headache. Should I check my blood pressure? And I think all of that is fair, or at least for it to be top of mind. If you at least know that these are things that are possible, it's better to be reassured that that's not what's going on and to make sure than to wait till it's too late. And then now we have a major complication.
Or just a
complication. And we have a major problem on our hands and we get to it too late.
The symptoms that you talk about, are they the same type of symptoms during pregnancy and after delivery, or they're two sets of different symptoms?
No, the symptoms of preeclampsia are the same throughout. And the thing is not every woman is going to experience the symptoms of preeclampsia, and they're not always going to experience it the same exact way. But in pregnancy, in delivery, and even postpartum, a headache that is not being relieved with regular things like Tylenol or just increasing your fluids, sometimes dehydration can cause a little bit of a headache, and your headache doesn't go away. That's maybe one indicator that maybe something else is happening. If you start having weird sensations in terms of your vision, it seems like a fuzzy TV, or it's just so blurry, or you just can't focus, maybe another indicator that you may be having a sign of preeclampsia. If you start having abdominal pain, and that abdominal pain can be a dull ache, it can be very severe and intense. It feels like a sharp stabbing pain, especially if we're talking about abruption, like we've said before, or especially if it's in the right side of your abdomen, the upper side of your abdomen, because one of the complications of preeclampsia is that, like I said, it affects multiple organs. And one of the organs that it has the potential to affect is your liver. And in doing so, like I said, pre-eclampsia, because it has these things that when left untreated, unrecognized, can lead to other major complications. Another one is platelets. Your platelets, which is what helps your blood to clot, can be affected by severe preeclampsia. Your liver can be affected by severe preeclampsia.
So all of these, once you get to the effect, then that's called eclampsia.
Eclampsia is the seizure.
Is the final.
And I hate to say final because sometimes you may have preeclampsia that's not what we deem as being, so bad, so severe, meaning you don't necessarily show up with a headache and then all of a sudden somehow, because your blood pressure has skyrocketed, or even if you don't have super high blood pressure, but still can develop the eclampsia, the seizure part of it.
So you had mentioned to me, and if you're open to sharing that with everybody, you told me that you actually had an episode with preeclampsia with one of your pregnancies. Would you share that story with us?
I did. I myself personally had preeclampsia with my first pregnancy, and again, started to develop when I went in for, I think maybe my last visit, perhaps. I had some elevated blood pressure. And then,
so this is about 2 weeks before?
Not even. No, because I delivered within days of that.
Okay.
And my pregnancy was complicated for a number of reasons, but certainly preeclampsia was one of them. It really showed itself even as being preeclampsia at the time of my delivery. during the labor part, I should say, even when I was in labor, I had multiple elevated blood pressures. There's so much that preeclampsia does. I gave you the major ones, but I forgot how nauseous I was. And that could be a sign of preeclampsia as well.
And was that really towards when you were closer to the pregnancy, when you started to have those blood pressure issues, or did you start to be nauseous even before?
No. This is in labor.
This is in labor.
Yeah, this is in labor. This is in labor. And actually, now that I think about it, I don't know. Was I nauseous because of labor? Was I nauseous because of preeclampsia? But I certainly put those two together in my mind. But I developed the high blood pressures. I remember feeling very like, I don't know, weird in my head. I can't even call
confusion?
I don't know if I would say it was confusion. It was like a pressure. It was like a heaviness in my head is what I remembered feeling. And then I remembered them having to give me this medication because they said, oh, you have really high blood pressure and you have something called preeclampsia. We have to treat you.
During labor.
So
was that a surprise to you when they said that?
I didn't even know what preeclampsia was.
Okay, this is before you were an OBGYN.
Clearly.
Yes. She became an OBGYN after going through that first pregnancy. Right.
And honestly, it's a major part of how I ended up here. Why did I become an OBGYN? Right. Some of the things that I went through that made me, feel super connected to wanting to become an OBGYN. But one of the things that I definitely went through was preeclampsia. One of the things that I definitely had to go through. Now, when we talk about preeclampsia, we have to talk about what are some of the measures we take to prevent seizure.
Before you go there, so when they said, oh my God, you have preeclampsia, what happened after that? They gave you medications to lower the blood pressure?
They gave me medicine to lower the blood pressure. They gave me medicine to lower my chances of developing seizure. And that medicine, ooh, boy, it burns going in through your IV. And then it makes you feel lethargic and really out of it. But I'm happy for it. It made sure that I didn't have a seizure. But I remembered feeling like, well, what does that mean? And am I going to be okay after? Like, what's up with this blood pressure? And is my baby okay? I remember feeling that. But even in the moment, I still didn't get it. It's only now I can say, I'm like, oh my God, I can't believe I had preeclampsia. Because now I understand the gravity of being told that I have preeclampsia. But in the moment, I didn't necessarily understand all the things they were trying to tell me, except that I needed this medicine. And I remember when the medicine was going in, feeling like, oh my God, this is the worst thing ever. Do I really need this? Like anybody, like any of us would be like, right? Like my patients are like, well, do I really need this medication? Yes, you do.
Because you're like, I'm just nauseous. I mean, does it have to be that big of, I think that's sort of like the balance to think about. Like you were saying before, it's a headache. So you're just like, why am I getting all like ramped up because of a headache? But it's considering the situation you are in, it actually has a total different significance.
The other thing is that preeclampsia, once you've had it, you have a risk of developing it again. Number one, you have a risk of developing just high blood pressure after delivery in normal life. Like, unfortunately for me, I have high blood pressure.
And that started because of that point?
Well, it didn't start necessarily right after, but it increased my risk of developing high blood pressure. I also have a family history of high blood pressure.
Okay, so there's other
factors, but preeclampsia puts you at an increased risk for developing high blood pressure later on in life, And so these are some of the things that we really do need to kind of tweak in our brains and say, oh boy, maybe I need to figure out how to be more careful, manage my weight better, my diet better. And of course, some of these things are hereditary or things that will develop even if we've done all the things and taken all the precautions. But I think it's important for us to be in touch with ourselves and
to know this information.
This
information is not something that's publicly known, honestly. Like, it's not something we talk about.
We don't talk about it enough. It's important for us to, as women, especially women, reproductive age women who are having babies, and that we're in the most joyous points of our lives, that we understand that there are things that can happen, that can be complicated, that can go wrong. And it's important for us to know what the signs are, what the symptoms are, and to be able to bring that information to our healthcare providers, whether it's a midwife, your doula. So this is interesting. This is where having someone like a support person, like a doula, who may not be a clinical person, but understands enough to know and be able to support you and saying, hey, we need to get you to your doctor, or we need to get you to a healthcare facility to address this. This is not right.
If you want to know more about what a doula does, episode 11, we just talk everything about that with a doula. So just little information out there about that. So now that we've looked at all the different factors and potential complications, we talked about Downton Abbey, but we are in 2024. So I hope that science has advanced. Are there certain tests or certain things that women can do preemptively to see whether or not they have a higher risk of preeclampsia?
I think the most important thing when it comes to women, their pregnancy, is your regular visits with your physician or your midwife or your healthcare, whoever your healthcare provider is. Those regular visits gives us an opportunity to check your blood pressure, to check in with you to make sure that you're not having any signs or symptoms that we need to be concerned about. And we get a chance to check your urine. We're looking for those things that can be a sign to us that something is happening. For women who are already with increased blood pressure, whether it's because they have high blood pressure even before they were pregnant. I mean, that's a reality for us, especially in this country where so many women already have high blood pressure or diabetes. These are some of the risk factors, the things that can increase your chances of developing preeclampsia: diabetes, a previous history of high blood pressure, obesity, very young mothers and very old mothers. So women who are young, so teen pregnancies, your first pregnancy increases your risk of developing preeclampsia. Women who are over 35 having a baby have an increased risk of preeclampsia. And there is a new blood test that actually looks for specific marker that we think is associated with preeclampsia that can help us to predict a woman who comes in with an elevated blood pressure that we suspect may have preeclampsia or may already be given a diagnosis, but who may develop severe preeclampsia.
And so this is safeguarding the woman and the fetus.
Of course.
Because you're going to then deliver earlier to not succumb to potential severe effects.
Yes. So with that blood test, it's the negative predictive value of it that's so much more important. That if we test the woman and she is negative for developing, on the test, that has like a 96% predictive value that she will not move on to severe preeclampsia in the next 2 weeks. And so that may help us to make better decisions in terms of, do we hospitalize this patient? Do we keep them hospitalized? How do we monitor them outpatient? Can we monitor them outpatient? So that might be a woman who comes in with elevated blood pressures, but we do this test, and this test says her chance of developing severe preeclampsia over the next 2 weeks is very low. So now we may feel more comfortable saying, okay, we can monitor this patient outpatient, have her monitoring her blood pressures, have her coming into the office a couple of times a week, or, a few times over the next 2 weeks, as opposed to then having to keep that patient in the hospital. That's one aspect. But another aspect is if she has a positive and she has all these other risk factors, etc., then that is a person who we're going to say, we're going to keep super close monitoring on, and any little change may help us have a lower threshold for delivery, for example, because we know that delivery will help oftentimes with resolving the preeclampsia.
This test, is it a standardized test, or it's more if we see certain issues from a high blood pressure perspective?
It's definitely not a standardized test. It's not a test that we want to just test every woman who walks through the door.
Okay.
That's a no-no. We want to test women either that have presented with signs or symptoms, and we want to test women who are at the highest risk.
Okay. So that was a lot of information,
know,
but
so much.
we needed to talk about this. For me, the biggest takeaway is, number one, that preeclampsia still exists. Number two, what are the signs and the symptoms that women who are either pregnant or either already delivered a baby need to be aware of? And then number three, that thankfully we now do have a test that can actually help us, guide us in certain women who might have complications due to preeclampsia.
And as far as women are concerned, I always go back to this. It's so important to be in tune with your own body. If something doesn't feel right, it's probably because it isn't right. If you within yourself know that you don't feel like yourself, or there's a big change, oh my gosh, it's so important, especially if you have any of the things that we've just talked about, that you bring that information up to your healthcare provider. And if for whatever reason that seems like it's being dismissed, then go to your local hospital, go to your local labor and delivery, and get it checked out.
I'm so happy we're doing this episode. I guess there's a reason why it's called Preeclampsia Awareness Month, because people need to become aware of, even to recognize and how to talk about this.
And we need to talk about it. We need to share it with our families. You know, women, if you have had preeclampsia, you need to tell your friends what you went through so that they then know that this is something that can happen to them. And it's not to be an alarmist. I don't want everybody to now then be scared. Oh my God, I'm pregnant. I'm going to have preeclampsia. No, but at least if you know it's something that exists, you can at least ask questions when you go to your doctor's visits. You go to your prenatal visits, you can say, Doc, can we talk about it? I am 200 pounds and I'm 5'5". I'm a little nervous, or now I understand that I may be at increased risk of developing preeclampsia. What are my other risk factors? And that could be the conversation that helps you to understand, and your doctor puts them on notice.
Yes.
Until next time, we're so happy to have shared this information with you. See you later.
Bye.
Bye. This is general medical information based on my professional opinion and experience. For specific medical advice, please refer to your physician. Until next time, embrace your body, embrace yourself.